Now I will give you an overview about our network and also our team, and also what are the aim and objectives of our future blood testing network. So our team, so you might have already seen the faces on the screen, that we have a very fantastic team and in the diverse areas and in diverse discipline. So myself, Vicky, I'm the director of the network, and we also have Rob from University of Kent, and Mark from University of Warwick, and Jeremy from University of Southampton, and Sergey from University of Nottingham, who cover different aspects of our network, and who will also give an introduction after my introduction in our network. And also have Samantha, who has been organizing and managing all of the aspects, the logistics and the communication of our network, and Steve, who has been helping on the also other aspects of communication of a network. So we have a very strong team of the P and co-Is, and also a very strong managing team in our as coordinators. So when we're looking at this, looking at the grand challenges over the years, so we have been noticing that the grand challenges in blood testing in the community health and care. So our network starting to looking at more about how could we transform the community health and care by transforming technology in blood test. And because blood testing, so we are looking at it, is one of the most common types of a medical test to assess a different various aspects of the health status. And also, if you look at the demand, especially during the pandemic, a lot of patients would rather to have the blood testing and also monitoring at home rather than going to hospital. So there are a lot of high demand for the laboratory-based blood tests from community settings. And also a lot of the patients are waiting for the decision for the diagnosis because of the delay, also the quite a lot of demand of the blood testing. So and also from the statistics from NHS pathology, digital pathologies, we're talking about around 95% of clinical pathways really relying on the patient having access to a more efficient, timely, and cost-effective pathology services, where blood test is a majority part of the pathology, pathology services. And most of the time, if we have the very inefficient and infrequent blood testing, that will always lead to a lot of late diagnosis. One of the important part, for example, is cancer. So we really need to identify the cancer in the early stage rather than late. So then blood testing is one of the key tests that to help the decision makings of the cancer diagnosis and other disease diagnosis, as well as the disease progression, and also the treatment monitoring. So this is very important for the patient with chronic disease and for them to manage their health, their treatment. And also on the other hand, so NHS, we have digital first strategy. Over the years, we have quite a lot of the digital transformation in the digital hospital, and now especially highlighted by the pandemic again. So we're starting to have virtual clinics, so virtual ward and virtual clinics. And then we're thinking, so now we are able to have the virtual clinic, virtual consultation, but how about have another step forward beyond the virtual clinics? How about if we could do our blood test at home? What if we can do blood tests at home, or what if we can remote monitor our key blood biomarkers at home remotely? So then we start to think about the solutions and to enable the patients and also the health professionals to carry out their own blood test remotely. So that is beyond the virtual clinics. Not only we can have virtual consultation, but also we can identify and also remote monitor the blood biomarkers. And also that will help to speed up the decision makings, and also the data we got from the remote monitoring will be really valuable and helpful for the more personalized analytics, for the timely detection or timely referral, or and also detection of abnormality at an individual level, rather than just at the population reference level, but also more at an individual level to identify any subtle changes of your blood biomarker, and that may indicate some disease. So that is the grand healthcare challenge our network are going to focus on, and so having this grand challenge in our mind, so our network, so we propose a network for the inclusive monitoring and the personalized analytics. So then our network really trying to build a multidisciplinary community to develop the technologies for the remote, rapid, affordable, and inclusive monitoring and personalized analytics. So that is really what we want to bring this technology, not only in the laboratory and the hospital, but also bring those technology at home. So, and also affordable. So, and then how could we do that? So we will really need to build a community of the different researchers in different areas, and clinicians and patients. We have patient representative from our clinical partner as well, and industrialists to be engaged and in addressing those challenges of the blood monitoring and analytics, and to manage the disease more effectively. So our network, so having this vision in mind in this next 3 years, we hope to work everyone here together to build this community, coming up good idea, really good ideas to look at what type of technology can we develop to address this challenge, and also manage this disease, and also to meet the clinical need. So to give a brief introduction about our vision from a technical point of view, so our future blood testing approach, as you can see from on the right-hand side, is like a closed loop, but we're really starting from the patient at a non-clinical setting on the top. So we're not talking about patient having blood tests at your GP, but we look at how could we do a blood testing, blood sampling, and the biomarker detection, and in an affordable and in a portable device, or even in a non-intrusive device for the patients. And then how could we use the data, make the device connected with an NHS, and so the ICT solution, and then use the data in personalized analytics and AI to support the decision making in the patient pathway in the different disease areas. And also we have different clinical area, exemplary clinical area, for example, cancer and inflammatory arthritis, as well as diabetes. So how could we use the technology to meet the unmet clinical needs in different disease clinical areas? So we have 3 key research areas. So first of all is remote blood monitoring. That is more about the engineering blood process outside hospital. And then the second will be the digital information and communication technologies. And also, and finally, is that the third key technical challenge will be personalized analytics and AI. And our vision is really to bring the 3 technical challenges together, and we hope to have the community to build new digital system or digital health platform to support more real-time blood monitoring and self-management and timely intervention in the community health and care. So that means we really need to work together in the different research experts in a different area. So our colleagues will introducing details about the technical details about different areas, but I will just briefly mention what we are looking at a higher level. So for the remote monitoring, well, Sergey will talk a little bit more after me. So we're looking at sensing point of care devices for blood biomarker identification in a non-clinical environments, and also how could we have like the imaging and apply optics and also electron engineering for wider range of blood biomarker monitoring at home, and then how this technology can come up with portable and affordable device to obtain high quality blood monitoring information. And the ICT part will be more about data connectivity, security, data standard, and connection with electronic health record in NHS. So how could we use this connectivity to ensure that the data can be fully used for the personalized analytics and AI, which is the third part of our technical challenge. And so this part, we're really looking at the two aspects. So first of all, it's a personalized analytics of all the healthcare data, including the EPR data, remote monitoring data. And then another part is that how can we use AI in the molecular and chemistry and the blood to process blood sample. So we have some clinical areas. So our colleagues will talk in the second session in our launch event today. And our partners, we have fantastic international partners from different countries, as you can see from the left-hand side. And also we have 5 NHS hospitals as our clinical partner who provide from clinical advices and also support from patient representative. And also we have strong companies, technology companies who provide from industry point of view. And I can't avoid mentioning that our network can also be seen as a network, kind of network of networks, because our co-directors also coming from different network, for example, Cyclops networks, and also AI for scientific discovery network, OA Tech, and the ITSHT in terms of food things. So as all brought by our co-director and coordinators. So we have a fantastic partners, and also those partners are expanding. Well, our key network activities, we have meetings like today at events, and also we will have yearly network workshops to identify the key challenges, opportunities. We'll have a stakeholder meeting where Sammy will introduce more detailed in her presentation. And one of the key aims is that we are going to have develop really good research proposal for the really good technology and a larger funding application. And we also provide we call collaborative innovation project for this to seed fund the feasibility studies. And also we will fund landscape report, look at all the technologies and challenges and to provide recommendations for the policy makers and for the practitioners and for researchers as a roadmap for the future blood testing. So this is all for the overview of our approach of our network, and I will hand it over to our colleagues to introduce more details about the different technical aspects of our network. Thank you very much.